Everybody, I am Rania Al-Jamal, the moderator of this webinar. Welcome everybody from everywhere who joined us this evening to attend our webinar titled Patient-Centered Care, Bridging the Gap Between Patient and Pharmacist. Actually, our speaker for today is Dr. Ahmed Arusasi, who is known to have big expertise in the field of pharmacy practice. We are very pleased, Dr. Ahmed, that you fortunately has accepted our invitation to discuss and present hot topics and latest topics in pharmacy practice. Before heading to a detailed introducing to our speaker, I want to remind the attendees, as usual, to drop your questions in the question and answer box during the presentation, and I will take your questions sequentially after the completion of the presentation in order to be answered by Dr. Ahmed. Now, heading to introducing our speaker, Dr. Ahmed Arusasi holds both a master's and a bachelor's degree in pharmacy, as well as a diploma in regulatory affairs. Dr. Arusasi continues to practice pharmacy in Canada while also serving as the general manager of a Noor Drug Stores store and as a lecturer and trainer at various universities and institutions in Jordan. In addition, Dr. Arusasi was an instructor for the University of Toronto's International Pharmacy Graduate Program and a trainer for pharmacists specializing in methadone treatment for addiction and chronic pain. He has also served as an OSCE assessor for the Pharmacy Examining Board of Canada for 5 years. He has also held council membership in pharmacy faculties of local universities and played a significant role in advocating for the Jordan Pharmacists Association by liaising with the Ministry of Health and the WHO on Jordan's National Action Plan for Antimicrobial Resistance. Dr. Arusasi was recognized with 2 prestigious awards, the Distinguished Pharmacy Practice Award and the Best Pharmacist Technician Team Award in 2004 in Canada. Dr. Ahmed Arusasi will present and discuss his lecture talking about patient-centered care, bridging the gap between patient and pharmacist. Hello, Dr. Ahmed. We will start with you now. You are welcome again. The floor is yours and you can start your presentation.
Thank you very much, Dr. Rania. Thanks, everybody. Thanks for Dr. Tamadur. Thanks, Dr. Ghattas. And thanks for IVPN Network representing with the president, my friend, Dr. Osama Tabbara. I'm very honored actually to be presenting to you today and sharing this experience with you. Thanks for everybody. Thanks for the attendees, actually, which make this event very rich and very valuable. So today we'll talk about patient-centered care, bridging the gap between patient and pharmacist. And this is for sure, I'm sure that most of you is known about this to be let's say, the core of the patient-centered care. And we'll go over patient-centered care, actually, which is a trend for the pharmacy practice or pharmacy practice in nowadays, as well as actually most of healthcare professional practice in general. So in the next an hour, I hope we'll cover the following topics. We'll go over the introduction, then after that, we'll go and briefly mention something about pharmacy practice advancement, what's happened to the pharmacy practice and advancement in the past, let's say 20 or 30 years. Then after that, we'll focus more on patient-centered communication in pharmacy practice, and we'll talk about patient-centered care process, the 5 process that I want everybody to memorize as pharmacists. Then at the end of our presentation, I will go over take-home message, which is very important for us as pharmacists. Actually, it's, this world is full of advancement and changes. And as pharmacists, we have to be proactive, and we have to adopt the changes, maintaining our positions as pharmacists in the community. First of all, let's go on the introduction, and let's talk about machine and information technologies, which are invading the human resources due to their efficiency, and there is no doubt about that. But currently, robots perform continuous monitoring of medication segregation and dispensing. And we noticed that actually in the Western world, that there is a dispensing machines in the pharmacy, or let's say outside the pharmacy. And what's happening is that the professionalism and the skill of healthcare professionals cannot be replaced with automation. This is very well known, because what doesn't matter what, we still have, as a human, we have the sense of humor, we have the empathy, we have the communication skills that the computer cannot simulate, doesn't matter what, okay? And pharmacists must modulate their communication tool, which electronic devices cannot. And this is very well known. Pharmacist role has changed from dispensing medicine to patient care as part of the healthcare professionals, okay, or healthcare professional team. Pharmacists in the Western world actually is not dispensing or are not dispensing medication anymore. This is a job for the robots, or this is a job for pharmacy technicians or pharmacy assistants. Pharmacists are doing much more, let's say, more enriched, or let's say valuable role. People perception about pharmacists had changed even, like what the person or what the patient is expecting from you when it comes to your pharmacy is expecting, not as what they're expecting from you 20 years ago. They are focusing on various health services on both individuals and community basis. And the cost of misuse and overuse of medicines actually constitutes more than 10% of the total healthcare cost. And this is actually very well documented in literatures. And community pharmacists are very accessible, and we know that whenever somebody is sick, or let's say a kid sick in the family or whatever, we don't seek for a clinic right away, or the hospital. We go to the nearest community pharmacies, and we are seeking for help, or we're seeking for medication. Pharmacists should be competent, okay, to stand professionally alive and show their value to the society. Also, the proficiency they require from their pharmacy school is not adequate. Actually, whatever we've taken or whatever we learned in 5 or 6 years school in the university, never been adequate, because the vast majority of specialties in pharmacy practice are actually more than 44 sessions or sections. And to offer better health sector, pharmacists should update and gain more credentials. They should seek for specialties, subspecialties, board specialties, okay, and certificate specialties. Before we go deeper into our presentation, let us present some cases, actually, cases of interest that I found that might be helpful to guide us for the next of our presentation. This is a prescription that you see. It's from Dr. Khalid Ahmed. This is actually a fake name that I create myself. And this is for a name named Samira Ali. She's a female for sure. And she's living in Amman. And there the date is written on the prescription. And the prescription is written for diclofenac SR tablets, 100 milligram. And the instruction on that one is take 1 tablet once daily, and dispense daily tablets. Looking at this prescription signed by the doctor, dated, and everything is full and very legit prescription. And the patient has taken the prescription, gone home, though the patient was experiencing some pain in the knee, coming back to the pharmacy 2 days ago, and is still suffering from the pain. And said, are you taking the medication? Yes, I'm taking the medication, but there I couldn't feel any difference. Okay, are you taking for sure? Are you taking once daily? Yes, I'm taking it once daily. All right, but how come, why it's not doing the trick? I said, I'm not sure, but I could see, I could swear, that's what the patient's saying. I could swear that I could see it in the pouch. What pouch? Okay, so the patient, the pharmacist is asking, what pouch? Eventually, what's happened to know, or what happened to happen, is that we know that the patient actually is having an ileostomy. She's an ileostomy patient, and you know that kind of patient who have an ileostomy in the ileum, and the medication is a sustained release medication, okay? It can be on maybe intracoated medication. And you know, the intracoated or sustained release medication, it needs the entire lumen of the intestine in order to release the medication. So what happens, the lumen actually, or the ileum is the first part of the small intestine. And what she said that I swear that I could see the tablet or the pill in the pouch. That's exactly what she means or what she meant. So the medication actually happened to pass through the feces, through the or to the pouch without getting absorbed through the system. So what's happened then? Then we know that there is a mistake. So pharmacists usually have to ensure 5 hours when they dispense their medication. That was in the past, actually. There's an update in this one here. So the right medication or the right medication to be given to the right patient by the right route, at the right dose, at the right time. So what's happened really? We gave the right medication or the right dose to the right patient, right? And via the right route and at the right time. But what's wrong then? What's the R that's missing is the right drug. Are we given or have we given the right drug? No, we haven't actually. In this kind of patient needs an immediate release formulation rather than sustained release formulation. So what's the result? What's the result in? Treatment failure, because actually the patient has not utilized the medication that we have given here. This is another case of interest. This is a 36 years old man, was prescribed fentanyl. Fentanyl patches, you know, fentanyl patches. The name actually for that one is Duragesic, and fentanyl is a very potent narcotic. It usually comes as a patch, or let's say a skin patch, to treat pain resulting from back injury. What happens is that he was not informed, that patient, a male patient, 36 years old, was not informed by either the doctor or the pharmacist that he could make the patch unsafe to use. But what's happened later on? He fell asleep with a heating pad on, and eventually he died. Oh, okay. Then what's happened? We know that the heat usually speed up the absorption. And when that medication actually is supposed to be absorbed over time because slow release in the patch, so applying heat usually actually make the absorption speed up. And when they tested the blood, they found out the fentanyl is 100 times than the level that should be in his blood. And this is actually an actual case that happens. All right. So what's happened here really? Have we given the right medication? Yes, we given the right medication. We give it to the right patient. We give it to the right that right time, at the right via the right route, at the right time. So all we have actually fulfilled all 5 R's. Then what's happened? What's happened? What's gone wrong? There is something missing, right? Before we do that, or before we explore that, let's see what is the role of the pharmacist these days. There is treatment failure in this case, we know. Now we know that the pharmacist can be a teacher, can be a manager, can be a communicator, researcher, leader, long life leader, and the most important role of the pharmacist is being a caregiver. So being a caregiver from a pharmacist, he has to assure 10 R's rather than 5 R's. He has to assure giving the right medication to the right patient in the right dose at the right time via the right route, and he has to assure the right to counsel and educate. Also, he has the right to refuse dispensing the medication if there is a suspicion case going around. Also, he has to assure the right history taking and assessment, and the right drug relation problem evaluation, and the right documentation. All these R's must be performed by the pharmacist. Going back to our case, what's happened? What's happened wrong? What is the R that's missing? The R that's missing is R number 6, which is the right to counsel and educate. So the patient has gone from the pharmacy without being counseled by the pharmacist. And that's why the mistake has happened, and he has slept with the heating pad on, and that increases the absorption of fentanyl and cause abnormal level in his blood and causing respiratory depression. And again, this has caused the treatment failure. Going to the second option, or the second thing in our session, our presentation, which is the pharmacy practice advancement. And we know there is an advancement in pharmacy practice happened to be in the past 30 years. If we go back to 1970s, we know that pharmacists were focused on the products mainly rather than the patient or the disease, focusing on identification, preparation, dispensing, availability of the product. But it has been shifted a little bit from 1970s to 1990s to disease and condition center practice, emphasizing signs, symptoms, pharmacotherapy, outcome of a particular disease, clinical pharmacy. And if we go to what's happened in 1990s, actually it's a big evolution of pharmacy practice. Clinical pharmacy actually happened to be like more advanced, and pharmaceutical care, medication therapy management start to arise recently, and patient-centered pharmaceutical care. Okay, why this advancement have happened? We know that polypharmacy and multi-meds used without counseling or consulting with healthcare professionals have actually increased lately. Also, there is an increase in medication-related problems, dispensing errors, morbidity, and mortality. More than that, there is an increase in health costs, and we notice that. And one of the most important points, actually, there is an increase in patient self-care. Patients start actually choosing the medication for themselves by the presence of the internet. Patients start reading about what to take for certain diseases or certain symptoms, and they start choosing for themselves or buying online. And there is a complementary medication as well, and lots of natural products happen to be in the pharmacy. All right. And if we go back to the patient counseling history, we notice, or we could tell, or we could read that between 1922 and 1969, pharmacists were prohibited from discussing therapies with their patients. And if any of you happen to be in the United States and they will go and gone to visit, let's say, an older pharmacy, they will see that there is the site for prescription. Actually, it's a way higher than the floor itself. And pharmacists usually used to prepare the medication, dispense it through a little window, okay? They are not allowed to talk. They were not allowed to talk to patients at all. But what happens in 1998, the Pharmacist Practice Activity Classification, PPAC, which is developed by the American Pharmacy Association, describe pharmacist activities, which is patient interaction. Okay, then, all right. What is patient interaction, American Pharmacy Association? They said, okay, patient interactions involving interviewing, education, or counseling the patient, obtaining patient information, providing verbal and written information, discussing, demonstrating face-to-face patient contact. All right. And there is something called the shifting of pharmacy practice. Shifting from back then to now. What happened in practice focus? In the past, practice was focusing on product and services, but nowadays focusing on patients and therapeutic outcomes. The service base in the past was serving customers, but now it's caring for patients. Practice base was based on knowledge and basic education, but now it's building problem-solving skills. In the past, patient care was little communication, fragmented service, but now it's more communication and counseling and continuity of care. In the past, the status among healthcare professional pharmacists were independent professionals, but now they are actually being a member, very integrative member of healthcare team. And talking about in the pharmacy, pharmacist is answering questions and dispensing meds. But nowadays, actually, pharmacist is listening to patients and explaining meds usage, providing patient care. And there is happened to be a medical role or medical model, which is actually the older fashioned model. And nowadays, there is what's called patient model. So patient role in the medical model, in the older model, was patient role is passive. He doesn't talk. He's quiet. Even some doctors, they didn't consider him present in the room when they start negotiating about his case. Patient role is active in the recent or the newer role, which is the patient role, is his active role, and patient asks questions. Also, the treatment focus back then, or on the older model, is patient is the recipient of the treatment, but now in the patient model, patient is a partner in the treatment plan, and the patient asks about options. Pharmacist role in the past, in the medical role, pharmacist dominates the conversation, okay? Does not offer any options. But nowadays, with the patient role or a patient model, pharmacist collaborates with the patient offers options, discuss pros and cons. Care focus in the past model, which is medical model, care is disease-centered, but now in the patient model, care is quality of life centered, the patient focus in family and other activities. And pharmacist-patient communication in the past model or the old model, pharmacist does most of the talking, but nowadays, the newer model, pharmacist listens more and talks less. And if we consider treatment plan, patient may or may not adhere to treatment plan in the older model, but in the newer model, patient is more likely to adhere to treatment plan because he's part of it, and actually he was part of the collaborative team when they put the plan together. Okay, then after that, Hippler and Strand, they came 1990s, and they we're talking about something called pharmaceutical care, and they defined pharmaceutical care to be pharmaceutical care is the care of the provider, who is the pharmacist and the physician or other healthcare professionals, for the recipient of the service, who is the patient, in the field of the subject of medicine, pharmacotherapy, medical device, drug-related needs, and healthcare, disease prevention, so on, etc. And to assure what? To assure the outcome. And what's the outcome? Is the optimal pharmacotherapy, optimal economic, clinical, and humanistic outcome, optimal quality of life. By what? The activities. What kind of activities? Counseling, medication review, detecting, resolving, and monitoring actual and potential therapy-related problems. All right, then after that, here is what comes. Patient-centered care. What is patient-centered care? And this is something I want you to realize, because actually in my previous, let's say, presentations to some university students, when I asked them what's patient-centered care, they really don't know anything about it, or they a little bit about this term. Patient-centered care is the care that meets and responds to patient wants, needs, and preferences, where patients are autonomous and able to decide for themselves. So the patient has to be part of the plan that we, as healthcare providers, we have to let's say draw or implement in order or for the sake of his health or best care of him. Now, accordingly, there is lots of changes happen to be, especially with the term that related to patient or to medication taking. In the older school, we used to use the term compliance. Compliance, actually, if you think about it, what it means. Compliance, actually, this is something that used in the army, okay? When a soldier want to be obedient to a lieutenant, he has to be obedient and compliant to what the orders coming from above. Is that really the relation between pharmacists and patients? The patient has to be compliant, obedient to our orders? No. So what they have done, actually, they improved this term and they start talking, changing it to adherence. So rather than medication compliance, start being medication adherence. But what happens now, actually, after what's called the patient-centered care, we start talking about concordance. We start talking about patient concordance, that actually how appropriate the medication is with the patient situation. We talk about either personal situation, family situation, economic situation, even political situation, you name it. Okay, so whatever the amount of information you know about the patient, actually, the most, let's say, successful plan that you will implement and will be successful healthcare that will reflect on the patient health eventually. Then the aim of patient-centered care, well, actually two aims. First of all, we have to optimize, or in order to optimize patient health and to optimize medication outcome. All right. Now we'll move to the patient-centered communication in pharmacy practice. And this is very important. We have to know about pharmacist responsibility in patient-centered care. First of all, we as pharmacists have to build trusting relationship with patients. Second, we have to engage in an open exchange of information with patients or caregiver. Third, we have to involve patients in the decision-making process regarding the treatment. They have to be part of the plan. Third, we have to help patients to reach therapeutic goals that are understood and endorsed by patients as well as by healthcare providers. And last, we have using effective communication skills is essential in the provision of patient care. So we have to be a very good communicator, and this is actually one of the most important things. But how do us pharmacists put patient at the center of our care? First of all, we have to make them feel valued. We have not to neglect them, okay? They have to feel they are valued. And second, we have to respect their knowledge. Patient knows a lot these days, okay, because of the internet and what's going around. And we have to listen more and talk less, okay? And we have to respect their values and beliefs. Also, we have to involve them in whatever decisions we have taken or whatever plan we are implementing. Okay, so what's the advantage of patient-centered counseling? First of all, it establishes an ongoing therapeutic relationship between the professional and the let's say pharmacist and the patient. And second, it provides the exchange of information necessary to first assess the patient's health condition, second, implement treatment of medical problem, and evaluate the effect of treatment on a patient quality of life. All right. But there is 5 dimensions of patient-centered care according to Mead and Boer in 2000. They're saying first that we have to understand the illness experienced by the patient, the social, psychological, and biomedical factors. Also, we have to perceive each patient's experience as a person, unique experience and meaning of illness. Third, we have foster a more egalitarian or what's equal relationship with the patient. Also, we have to build therapeutic alliance with patient or therapeutic relationship to meet mutually understood goals of therapy. And number 5, develop self-awareness of personal effect on patients. So that means we have to put ourselves in their position, okay, or on their shoes. There is something called the 8 dimensions of patient-centered care. And when we actually assure these, let's say the 8 dimensions, first of all, assure patient preferences. And this actually, we assure that we implement it when the patient starts saying that pharmacist cares about what I want. Second, assures patient emotional support. And this is assured when the patient starts saying pharmacist cares about my fears and anxiety. Third, assure physical comfort. And this is assured when the patient starts saying that pharmacist make sure that I am comfortable and my pain is managed. And number 4, provide information and education. And this happened to be assured when the patient saying that pharmacist keeps me informed and help me understand. And the assurance of continuity and transition of care. And this happened to be assured when patients start saying pharmacist gives me what I need to continue getting better when it is time to going home. And number 6, assure coordination of care. And this is assured when the patient starts saying that healthcare professional team, including the pharmacist, work together to help me get better. And number 7, assure access of care. And this has happened or is assured when pharmacists or let's say patients start saying that pharmacist provides the support and service I need to help me get better. And number 8, which is the last, offer family, friends involvement. And this is assured when patients start saying that pharmacist includes my family and friends if I want to. That's based on his consent. Okay, so what skills needed by the pharmacist to provide patient-centered care? First of all, we need identifying the patient's healthcare needs. We need to prioritizing patient care in a busy practice. We need to recognize personal beliefs and professional judgments, also showing responsibilities as patient advocates and applying philosophy of practice, establishing therapeutic relationship with each patient underneath therapeutic relationship, okay, and carrying out clinical reasoning, clinical problem solving, and number 8, which is the most important, performing clinical practice skills. And what is the clinical practice skills that we have to perform? First of all, knowledge or clinical assessment skills. Second, physical assessment skills by pharmacists. Third, which is very important, communication skills and patient counseling skills. Fourth, caring behavior skills, professional behavior skills, proficient documentation skills, and drug information and evidence-based practice skills. And the last skill is learning to be reflective in practice. All right. Now, patient role in therapeutic monitoring is essential to meet the treatment goals, okay? So we have not to neglect or ignore the patient role. For example, we know that INR and HbA1c values maybe provide a scientific basis for therapeutic monitoring, right? This is for sure. But patient management of warfarin dosing have led to reduced incidence of major bleeding. Fact. Certainly, patient self-monitoring of blood glucose has become standard practice in managing diabetes. No doubt. And example 2, for many chronic conditions, you must consider patient's report of response to treatment or to medication as pharmacist. For example, depression, pain, asthma, angina, epilepsy, and arthritis rely heavily on patient reports of symptoms. All right. Then we'll go on what's the patient role in medication use. Patient role medication rule actually involves 3 steps. Step 1, patient perception and interpretation. Step 2, which is patient action. Step 3, which is patient communication. Let's go to step 1, patient perception and patient-centered view of medication use process. The first one is patient perception and interpretation, and that is the medication use process for patients begins when the patient identifies a healthcare need for health-related problem. He has to be convinced, okay, and he has to be aware. Second, the patient then interprets the perceived problem. This interpretation is influenced by a host of psychological and social factors unique to the individual. All right. So what that includes? First, the individual previous experience with formal healthcare system, or family influences, or cultural differences in the conceptualization of health and illness, and knowledge of the problem. Individuals vary greatly levels of medical and biological knowledge. Okay, this is actually a fact, and health beliefs that may or may not correspond with concept medical truths, and psychological characteristics, and personal values, motives, and goals, and so on. And the last one is the influencers, either family influencer, friend influencers, either from the healthcare or health background or non-health backgrounds. Going to step 2, which is patient action. The patient action can be either no action at all, because either the problem is seen as minor or transient. He doesn't care at all about this problem and he doesn't see it as a problem, or the patient lacks the means to initiate the treatment. And maybe the patient takes an action, and the action may be either by initiate of self-treatment, or initiation of contact with non-medical provider, or let's say contact with the healthcare provider. Step 3, which is patient communication. A patient must describe his symptoms experience, and pharmacists must acknowledge the patient's symptoms and experience, make them valued and respect their perspective, correlate subjective and information to objective, or let's say correlate subjective information to objective information, and diagnosis. Diagnosis actually, either pharmacist may diagnose the patient's problem, pharmacist may make recommendations to the patient, or suggest referral, or recommendation could be initiate medication. Patient may or may not follow the recommendation though, okay? Now, ways to encourage the patient role in therapeutic monitoring. We have several points to mention to encourage patient being involved. Pharmacists must answer all unanswered questions, okay? Second, pharmacists must clarify all misunderstandings in the patient's mind. Third, pharmacists must solve all therapy-related problems. And fourth, pharmacists must encourage monitoring patients' response to treatment. Also, pharmacists must encourage patients to actively participate in making their own therapy decision. And the last is pharmacists must be proactive and initiate dialogue if not started by the patient. And this is part of the communication skills. Now we'll go over patient-centered care process, and this is something very important in the patient-centered care, especially when we start talking about medication therapy management, and that's another topic that maybe we can discuss later on. First of all, the first in this process is actually collect and analyze the information. Then after that, pharmacist must assess the information and formulate a medication therapy problem list. Then the third, develop the care plan. And fourth, this plan that we develop with the help of the other healthcare providers and the patient must be implemented. Okay, implement the care plan. And of course, in order to see that the plan is working or not, or it's a successful plan or not, we have to go and do what's called follow up and monitor and evaluate. Now, what to collect really? When it comes to collection, we are talking about collecting subjective and objective data, and maybe medicine and medical immunization history, prescription, non-prescription medications, herbal dietary and dietary supplements, health and functional goals, and lifestyle and habits, medical status, health, wellnesses, lab test results, physical assessments, references and preferences and beliefs, and socioeconomic factors. All right. Now, we collected all this information. We have to go and assess this information. So what to assess? Assess and prioritize the patient's active medical conditions, considering clinical and patient goals of therapy. We have to assess also the indication of each medication the patient is taking. We have to assess the effectiveness of each medication patient is taking. We have to assess the safety of each medication patient is taking. We have to assess the adherence of each medication the patient is taking. Also, we have to formulate a medication therapy problem list in order to solve what the biggest problem first, or the most concern to the patient, and then prioritize the patient's medication therapy problem. And we have to assess if there is a nutrition depletion caused by medication. And this topic actually is a special topic. We can go 3 hours talking about this issue. But how to, let's say, assess the indication, we have to ask ourselves 3 questions. First, does the patient have an indication for the medication? Second, is the medication appropriate for the medical condition being treated? Third question is, does the patient have an untreated medical condition that requires therapy but is not being treated or prevented? And if we want to assess the effectiveness of the medication, we have to answer ourselves 5 questions. Is the patient meeting a clinical goals of therapy? Or is the patient meeting overall personal goal of therapy? Or is the most appropriate therapy drug product being used for the medical condition? Fourth, is the dose, frequency, duration appropriate for the patient? The 5th question, which we have to answer, do additional lab tests need to be obtained to monitor the effectiveness of the medical therapy or medication therapy? And if we want to monitor the medication safety, we have to answer 5 questions. First, is the patient experiencing an allergy or adverse effect from the medication? The second question is, the dose is too high for the patient, or the frequency or duration inappropriate for the patient? The third question, do safer alternatives exist? Fourth question, are there any pertinent drug disease, drug food interaction, or nutrition depletion by medication? And the 5th question that we have to answer, do additional lab tests needed to be obtained to monitor the safety of the medication therapy? And if we want to assess the medication adherence, we have to answer 6 questions. First one, is the patient receiving the most affordable option to optimize adherence? Second question is the patient able to obtain his or her medication, and is not, if no, why? Third question, are the medication taken is convenient at convenient time for the patient? And the 4th question, is the patient taking the medication as prescribed, instructed, or any missing doses? The 5th question, is the patient is not taking, if the patient is not taking the medication as instructed or missing dose, why? We have to know the reason why. And the 6th question will be, is the frequency and formulation appropriate for the patient to optimize adherence? Formulation between 2 brackets. Remember our case study in the beginning? Okay. Now, the next step is develop the care plan. What we have to develop in the care plan? Assure the patient-centeredness in the developing care plan in collaboration with the patient and the patient healthcare provider to address any the identified drug-related problems. Also, identify the monitoring parameters to routinely assess adherence, indication, effectiveness, and safety. Also, review all medication lists to obtain an accurate and updated medication list or medication reconciliation. Determine and coordinate who will implement components of the care plan, patient, pharmacist, or other healthcare professional. Also, determine the type of follow-up needed and determine the appropriate time frame for patient follow-up and determine the appropriate mode of follow-up by phone or personal visit or the patient will come back to the pharmacy, so on and so forth. Going to our next, which is implement the care plan. Now, implementing the care plan, we have to consider the following. To consider discussing the care plan with the patient because he's part of the plan, remember? Ensure the patient understanding and agreement with the plan and goals of therapy. Also provide personalized education to the patient on his or her medication and lifestyle modification. Also provide the patient with updated, accurate medication list and implement those recommendations that you as pharmacists are able to implement. Communicate the care plan with the rest of the care team, okay, other healthcare professionals. Document the meeting in the electronic healthcare record and arrange the patient follow-up. And the last thing is communicate instructions for follow-up and with the patient. Now, follow up and monitor. What to follow up and monitor? They have to follow up the following. Outcomes of therapy, including progress toward the achievement and of goals of therapy. Also, the follow-up, we have to follow up with patient adherence through available health data, biometric test results, and patient feedback. Also, quick check-ins, assess general status of care, monitor, for example, blood sugar or blood pressure, INRs, providing the education. Also, medication appropriateness, which is very important. Actually, the appropriateness, I want you always to repeat it because this is actually what's all about concordance, medication concordance. So appropriateness, effectiveness, and safety if further evaluation is needed. Also, reassure preventative measures like including immunization. Last thing, actually, if we want to follow up, if no need for extra evaluation, ensure the plan for continuing of care with other healthcare team. Okay, so the situation when to follow up, either actually we have two situations, either medicine changes recommended in initial review or ongoing high risk medication related problems is existing. And we don't want to go through them actually because we want to go to our last session. So to allow some questions. Now, we mentioned lots today about patient-centered care and how to involve the patient in being part of the plan. But now I want you to consider the following. Just remember, first of all, the patient is the focus of our of the medication use process. Use your communication skills can facilitate building a trusting relationship with the patient. Also, it can foster an open exchange of information and sense of partnership between you and your patients. Also, remember, an effective communicator or communication process can optimize the chance that patients will make informed decision. Also, use medications appropriately, again, between two brackets, and ultimately meet the therapeutic goals. I want you to look at these pictures, okay? So these pictures, as you see, this is dispensing machines. This is dispensing machines. Pharmacist role is not dispensing medication anymore. And still, actually, I can see pharmacists, they put 3 lines to indicate 3 times daily. And sometimes they mention before meal, after meal. And I'm sure, actually, most of the pharmacists, they don't actually know the rationale behind before meal or after meal. Or sometimes they are guessing. So I want you to consider that the advancement, there is an advancement in the pharmacy profession. Now, our role is not dispensing medication anymore. Okay, this is the role of the machines. Our role actually is more about our humanity, about our empathy, about our communication skills, patient counseling. Okay, so where is our profession is heading to? It's heading to actually big things. Okay, lots of advancement, but we have to be a proactive. Don't stay at your level of comfort as pharmacist. If you are stay at your level of comfort, there is something wrong. Always seek for opportunities, seek for challenges. Try to convert this kind of challenges into opportunities. That's how to be successful. And go with the trend. Don't it's always stay in the obsolete mind and the mentality. You have to think with what the global is thinking right now. The advancement in pharmacy process. I would like to thank you all for being good listeners. I hope that you enjoyed my presentation, and thanks for whoever invited me to be part of this session. And I will allow the floor for the moderators.
Many thanks to Dr. Ahmed for the valued presentation discussing bridging the gap between patient and pharmacist. It was really interesting to know about it. Please again, dear attendees, do not miss the opportunity to leave your questions in the question and answer section. We now will go through the questions to take some questions from the attendees. Okay. We have actually a question from Hind. Dr. Ahmed, in the context of patient-centered care, how can pharmacists navigate the ethical dilemma of prioritizing patient autonomy when it conflicts with professional guidelines or evidence-based practices?
Okay. Now, actually, when I say that patient-centered care, and we have to consider the patient to be part of the healthcare plan, and his choice is big, actually part of the plan, as long as it's not interfering with our values, our standard practice, and the guidelines. Of course, I wouldn't actually, for example, let's say a patient who is get used to take, for example, tramadol, or let's say narcotic for his pain, and he's always seeking for this kind of medication, I wouldn't actually be compromised and always respond to what he's needing. So I have to be a very assertive, and not rather than being passive. I have to be assertive as regulated health profession, because I have to protect him first, or protect myself as healthcare professional and my license, and also giving him the respect he needs by giving him options. Okay, so I don't have to compromise all the time and give him what he wants. I always can offer choices, okay, to always come to the middle and agree on the point. So I wouldn't actually get him to choose whatever he needs all the time if that puts him in risk.
Okay. Another question, thank you for your answer. Another question also from Hind. He asks also, as the role of pharmacist expands in direct patient care, what justifications can you provide for the necessary shift in education and the training for pharmacists to effectively manage complex patient needs, particularly in areas like mental health and chronic disease management, where traditional pharmacy training may be lacking?
Okay. Actually, this is something that we have let's say the education, or let's say universities have to go parallel, go along with what's the advancement of pharmacy practice. Pharmacy education is not actually supposed to be as obsolete as it used to be. Okay, nowadays, being from my experience with the University of Toronto, actually with the IPG International Pharmacy Graduate Program. What we used to do, like we used to have a parallel session. We have to use a parallel session between theoretical and the practical. Let's say that this week is all the week will be about cardiovascular system, okay? The last day in the week will be all patient counseling, all practical cases about cardiovascular system, okay? How to perform patient counseling, how to treat, let's say, dilemmas in that regard, how to do medication therapy management, including cardiovascular medications. So really, there has to be a shift in the pharmacy education, and we have to think globally and act locally in this regard. Globally, by adopting the new changes happen to be in the pharmacy education as in North America or European countries, and embedded all these kind of changes with the practice needed for all pharmacists after they graduated, and they will benefit from the education rather just being focused on the theory. Let's have it all merged together as hybrid theory and practice at the same time. I hope this answered the question. You are muting. You are mute, Dr. Rania.
Okay, sorry for that. Thank you for your explanation to the previous question. There is one more question. It's asked, what's your advice to informing patients of a very major or highly critical care disease such as cancer? How can we utilize what you have explained in your presentation to provide good patient care and not cause the patient to panic or worry excessively?
Okay. This actually being a good communicator as a pharmacist, and you have to be aware of what's called pharmacy patient involvement and empathy, patient empathy. You always have to think of the emotions, okay? And by being empathy, I mean not being sympathetic here, okay? Being empathetic, you have always to feel the patient feeling without putting yourself like in the same situation. Let me give you an example. For example, if a patient say, "Oh, I'm very tired today because I have broken leg," okay? What I can say as empathy, I can say, okay, I'm very sorry to hear that. Yeah, I understand that, you know, broken leg is really painful, and I'm sure that you are suffering from pain. But the sympathy is by by start crying and holding him, like hugging him, and said, "Oh, I'm very sorry. Yeah, it's very painful. I've been through that." And so this is not the healthcare professionals' behaviors. We have to be empathetic. We have to know exactly how to talk to a patient with cancer. We have to know his exact feeling. We have to offer him all the protocols needed, let's say, offered to help his kind of cancer. But all these has to be put, all the evidence base, okay, the protocols of treatment, along with our empathetic behaviors as communicators, and always making him feel that he's safe, he's in good hands, and he will receive the proper treatment that will reflect on his health, and hopefully he will cure from what we offer.
Yes, I think for that question, you mean the understanding response, because there are many responses. Sometimes we have the probing, the quizzing, and other responses. In addition to the sympathetic, as you said before, the understanding response, which includes such talking to the patient, for example, saying to him, "I feel your sensation," or "I feel with you," with no judging, with no advices and other advices to this patient. Okay, one more question to Dr. Ahmed. It's asked from Gacha. How can a pharmacist effectively educate and guide a patient to choose a particular brand of a medication when there are multiple alternatives available, ensuring both safety and patient convenience?
Okay, so hopefully we are talking about the same medication and the same active ingredient in different brands. That's actually what I understood. So being a pharmacist, we understand that any medication, until to be registered, it has to pass the bioequivalence study. And bioequivalence study that actually puts the medication to be between, let's say, 80 to 105% of the active ingredient of the actual brand of the originator. So having to consider this point, we can always focus on this brand or this generic medication is exactly as the brand or that he used to take, and the active ingredient is exactly the same salt, the same concentration, he will be expecting the same results. Now, though, we have to consider some other facts, which is variables, that the additives sometimes in some brands are not the same in the other brand. And this actually very essential and very important if somebody is allergic to one of the additives. Let's say one medication can have, let's say, lactose, other medication which is in the same generic brand, okay, on the same active ingredient, the same strength, whatever, but have lactose in it, okay? So in this case, patients who are lactose intolerant must be actually treated differently. But in general, our knowledge and experience that we know and we are sure that generic medication will not be registered in any country unless it passed bioequivalence study with the originator of the same product and the same combination. Mute. Doctora, you are mute.
Yes. So
Sorry.
thank you for your answer. We have the last question from one of the attendees. Fadia asked, which one help in providing patient care to be a clinical pharmacist or pharmacotherapist or both?
Can you repeat that question, please?
Yeah, I didn't get it too. Which one help in providing patient care to be a clinical pharmacist or pharmacotherapist or both?
Thank you. Thank you.
I think.
Okay, great. Now, I just want to give you an example. Clinical pharmacist, when we say clinical pharmacist, we say either PharmD or a pharmacist, BSc pharmacy, holding a master degree in clinical pharmacy. Okay, and pharmacotherapist, I understood pharmacotherapist, when you say pharmacotherapist, a pharmacist with pharmacotherapy board specialty. Okay, or pharmacotherapy is specialty like ASHIP, they give pharmacotherapy specialty. So now, either PharmD, clinical pharmacist, or pharmacotherapist, they are actually able to manage or perform medication therapy problem, or let's say medication therapy management, okay? But to give you an insight, there is a new board in the United States called Medication Therapy Management Board. So if I have the choice to choose somebody, for example, for a pharmacy that I own, somebody who will hold or who will perform medication therapy management, and I have PharmD, I have a clinical pharmacist master, and I have somebody with pharmacotherapy management or medication therapy management board, I will choose the board specialist. Okay, so any of them can help actually performing medication therapy problem. There is no problem in that one. And whoever is more trained, this is actually depending where he's graduated from and what they focus in during the graduation. Or let's say PharmD, for example, may be different in Jordan University than Jordan University of Science and Technology. Maybe in Jordan University, they will have somebody with an experience in medication therapy management that focuses in this part, but maybe in the other university, they don't have one. So actually, depending on what you've been exposed to, okay, and from the beginning. But again, if I need somebody specialized in medication therapy management, and I have somebody with board in that issue, I will choose the one with the board.
Okay. Thank you for your explanation. I have my own question, please.
Sure.
What is the most common dilemma, particularly I'm talking about, the ethical dilemma that may appear during the practice, and how can a professional clinical pharmacist, as you said in your presentation, overcome such dilemma?
Okay.
I mean, I want to mention the most common ethical dilemma in the practice. That some maybe just like third party or.
Okay.
I'm sure there are
Right.
many
Now,
dilemmas. Yeah.
Yeah. Actually, I think the most important in this regard is the personal privacy. Okay. I have as a healthcare professional, as a pharmacist, I have to protect the patient's privacy to the level that nobody will be even share, or I wouldn't share this kind of privacy or the health information with anybody else unless I got the personal or the patient consent with that. For example, let's say that I have to verify something with the patient's doctor. I cannot do so or do anything like that unless I ask the patient first, would you mind if I call your doctor, talk about this issue? If he give me the permission, I will go ahead and do it. If he doesn't give me the permission, then I will hold it. I wouldn't do it. And always think about something. If you are in doubt, leave it out. If you are in doubt, for example, you might think sometimes that you are doing this for the best interest of the patient, but maybe if you do that, it will the end results actually will be putting patient at risk, or let's say putting patient in big problem. So always ask for patient consent if you do anything like providing information to other healthcare professional, or grabbing or bringing information from other healthcare professional to related to the same patient. And this is something very important when it comes to people, let's say incarcerated patients, for example, patients in the prison or something like that. Because I practice community pharmacy in Canada, so I've been exposed to that to that issue.
Yes.
So even the police person, when he comes to the pharmacy and wants the information about any patient, I wouldn't allow any information without having an order from the judge allowing me or advising me to give this kind of information. Yeah. So
Yes.
patient privacy actually is the one that you want to protect the most and the biggest dilemma. Yes.
That's correct. I agree with you. Okay. Indeed, we have reached the end of our webinar today. And I would like to thank everyone who joined us wherever you are from. And a special thanks to our speaker, Dr. Ahmed Al-Rasasi. We hope all we got the benefits from your lecture. Thank you so much, Dr. Ahmed. For attendees, dear attendees, thank you for your notice. This webinar was recorded, and you can visit our IVPN library to get this webinar and other previous recorded webinars. Regarding the attendance certificate, it will be sent to you soon by emails. Thank you all and have a good night.
Thank you. Thanks for everybody.
Thank you. Thank you, Doctor.